Welcome dear students. In this video, let us learn about hypertrophic rhinitis. Hypertrophic rhinitis is one of the types of chronic rhinitis. Hypertrophic rhinitis. The characteristic feature of hypertrophic rhinitis is there is thickening of mucosa, submucosa, seromucinous glands, periosteum, and finally the bone also. So there is thickening of the entire structure, mucosa, submucosa, the glands, periosteum, bone, everything is thickened. In chronic simple rhinitis, only the mucosa was thickened. Here everything is thickened. And all these features are markedly seen on turbinates. Marked features are seen on turbinates. Now, what is the cause for all this? Why are all these structures thickening like that? Why are they hypertrophying? The etiology is, first and most importantly, recurrent nasal infections. If there are repeated attacks of acute rhinitis, recurrent nasal infections. If there is chronic sinusitis, if there is chronic irritation of the nasal mucosa, prolonged use of nasal drops, and vasomotor and allergic rhinitis. All or any of these conditions can lead to hypertrophy of the entire structure, all the structures in the nose, mucosa, submucosa, glands, periosteum, bone, everything will hypertrophy due to any of these factors, infections, chronic sinusitis, chronic irritation, and prolonged use of nasal drops, and of course vasomotor and allergic rhinitis. So what are the clinical features of hypertrophic rhinitis? The first thing that comes to our mind when everything is hypertrophied, there is very little space for the inspired air to go in, and the patient will manifest this as nasal obstruction. Hypertrophy automatically leads to nasal obstruction, and also there is nasal discharge. And how is this discharge? It is thick and sticky. And the patient also experiences headache because of the swollen turbinates. And finally, there can be episodes of anosmia because the inspired air fails to reach the olfactory area sometimes. So there can be episodes of anosmia. Upon examination of the nose, what we see is hypertrophy of turbinates. Hypertrophic rhinitis, we observe hypertrophy of turbinates, as simple as that. The mucosa is thick. And most importantly, it does not pit on pressure, and it does not shrink on application of vasoconstrictor drops. There is very minimal shrinking, or I can say no shrinking at all. So this is very important because in chronic simple rhinitis, what we have learnt is the mucosa pits on pressure and it shrinks on application of vasoconstrictor drops. Here in hypertrophic rhinitis, that stage is over. It doesn't pit anymore. No pitting on pressure and it does not shrink on application of vasoconstrictor drops. So this is an important feature to differentiate between chronic simple rhinitis and hypertrophic rhinitis. In one sense, I can say chronic simple rhinitis precedes hypertrophic rhinitis. It's an earlier stage of hypertrophic rhinitis. A patient of chronic simple rhinitis, if not treated at the right time, will and may progress into hypertrophic rhinitis. So maximum changes are seen in the inferior turbinate. So when we examine also, inferior turbinate is readily observed and maximum changes are seen in inferior turbinate. So the inferior turbinate can swell entirely, the whole turbinate is swollen, or only its anterior end is swollen or posterior end is swollen, only the inferior margin is swollen. Anything is possible, and sometimes just imagine this is the inferior turbinate and its anterior, posterior end and the inferior margin are swollen. It gives a mulberry appearance. So anything is possible. That special appearance we call it mulberry, that's all. So the treatment of this condition. How do we treat it? Most important is to address the cause. Why this has occurred, we have to analyze and treat it. But the turbinates are already hypertrophied. Even the bone and periosteum is hypertrophied. So now even if you address the cause, say the patient was chronically exposed to irritant gases, and at this stage even if you avoid the patient getting exposed to those gases, the turbinates are not going to shrink now because it's a permanent irreversible process that has taken place. At the stage of chronic simple rhinitis, if you had removed the cause, then it would have been reversible, but now the turbinates have irreversibly hypertrophied. So what we have to do is, the only option is to reduce the size of turbinates. We have to treat the cause, plus we have to reduce the size of the turbinates. How to reduce the size of turbinates? There are various processes that can be used. One, we can apply linear cauterization. Cautery can be applied and we can shrink the size of the turbinates, especially inferior turbinate. We do all these procedures on the inferior turbinate because the changes are most marked on the inferior turbinate. Second, we can do a submucosal diathermy. What is diathermy? High frequency electric waves are used and that will create some heat, and the heat will destroy the tissues. Next, we can do cryosurgery. What is cryosurgery? Briefly, an extremely cold minus degrees liquid or gases, the temperature is applied, and that will also cause shrinkage and death of the tissue. That is briefly cryosurgery. And otherwise we can surgically do turbinectomy, removal of turbinates, and this turbinectomy can be partial or complete. The turbinate can be entirely removed or only a part of the turbinate can be removed. Now, what is to be borne in mind is excessive removal of turbinates should be avoided, because that will cause too much space, widening, very roomy nasal cavities, and roomy nasal cavities will again cause another set of problems such as drying effects, crusting, all those problems can occur. So, this has to be borne in mind while doing turbinectomy. Excessive removal of turbinates has to be avoided. And we can also do a submucous resection. Submucous resection of the turbinates. So, what is submucous resection? Below the mucosa, that part we remove. In the sense, the bone is removed and the mucosa is preserved. So, in submucous resection, bone is removed, resected, and mucosa is preserved. Why should we do this? Because mucosa is the tissue that performs all the physiological functions of the nose, regulation of the inspired air, conditioning of the air, all these functions are done by mucosa. So, mucosa is very important. So, what we do is we preserve the mucosa, go inside and remove only the bony part. So, submucous resection can also be done, and of course, lasers are also being used to remove the turbinates, to reduce the size of the turbinates. Now, this is all about hypertrophic rhinitis, but there is another small important topic that has to be learned here, and that is compensatory hypertrophic rhinitis. What is compensatory hypertrophic rhinitis? Say in a patient of deviated nasal septum, the septum has deviated to one side. Now the other side nasal cavity has become very roomy. It has become very wide. And nature always tries to balance. Basically what happens is all the excess air that is entering, it will cause dilation of the blood vessels, vasodilation. This side of the nose is working extra hard to condition all that air. So there is hypertrophy of substances and the turbinates will enlarge in size. So the roomy nasal cavity will also become normal on par with the other side. And this is called as compensatory hypertrophic rhinitis. So to write it down, in a patient of marked deviated nasal septum, DNS, what happens is the roomier side due to the effects of excess air entry to avoid drying and crusting, it will show hypertrophy. The roomier side will enlarge in size. It will show hypertrophy of the turbinates, and that will lead to compensatory hypertrophic rhinitis. It is not the general hypertrophic rhinitis that we have seen. One side is roomy and that will hypertrophy to compensate. Now, another point that has to be remembered in compensatory hypertrophic rhinitis is if we treat the cause, say deviated nasal septum, we have surgically corrected, that will not correct the hypertrophy automatically. When we are performing the surgery, we have to correct the hypertrophy also surgically. So for DNS, if surgery is being performed to correct the septum, at the same time, if at all compensatory hypertrophic rhinitis has occurred, we have to do a partial or complete turbinectomy and resolve that also surgically. Treatment is simultaneous correction of DNS plus hypertrophic turbinate. So this is all about hypertrophic rhinitis. Let me quickly summarize. So the characteristic feature of hypertrophic rhinitis is thickening of mucosa, submucosa, seromucinous glands, periosteum and bone. Entirely everything is swollen and thickened. And all these features are markedly seen on the turbinates, especially inferior turbinate. So what are the causes for this? Recurrent nasal infections, chronic sinusitis, chronic irritation, prolonged use of nasal drops, vasomotor and allergic rhinitis. What are the clinical features the patient experiences due to the hypertrophy is, first and foremost, nasal obstruction. Second is there is nasal discharge. A thick and sticky type of nasal discharge is seen. Then the patient experiences headache. And of course, because the inspired air sometimes fails to reach the olfactory epithelium, the olfactory area, there is loss of smell sensation, anosmia, on and off loss of sensation. Upon examination, we observe that the turbinates are hypertrophied and the mucosa is thick. And if we apply pressure, it is not pitting. And even if we apply vasoconstrictor drops, there is very minimal shrinkage or no shrinkage at all. This is important. So in a given case scenario or a clinical scenario, this helps you to identify or differentiate between chronic simple rhinitis and hypertrophic rhinitis. And then we have to treat the cause, plus we have to reduce the size of turbinates. How can we reduce? By applying cautery, by applying diathermy, cryosurgery or surgical resection. Turbinectomy can be done. Submucous turbinectomy is a better option. Submucous resection, so that the mucosa is preserved and only the bone is resected. And of course, lasers are also being applied nowadays. Compensatory hypertrophic rhinitis happens when there is marked deviation of septum and for some reason one side is very roomy. One nasal cavity is roomy and it is exposed to all these drying and crusting effects, and to avoid that, the turbinates of that side hypertrophy and lead to compensatory hypertrophic rhinitis. So during surgical correction of the septum, even this turbinate has to be resected. The hypertrophy turbinate has to be resected. Automatically, if we correct the cause, correct the septum, this will not get resolved. We have to surgically resolve it. So this is all about hypertrophic rhinitis. It is a type of chronic rhinitis. Thank you very much.